Good afternoon. It's always good to be back in Nashville. I lived up here for many years, and to see the many friends that I still have here. And I appreciate the opportunity to speak on such a distinguished panel. I was looking through BlueCross BlueShield every day. We have a provision on our website that collects news headlines from across the state that impact our company or involve our company. And the headline on this particular panel today, I guess because I was speaking, was a bunch of right-wing lawyers talking about healthcare reform. General Summers, I'm glad to be included with you as a right-wing lawyer talking about healthcare reform today.
Thank you very much.
But as an insurance company general counsel and executive, I'm kind of used to the rhetoric. After all, if you read the papers, if you listen to the TV ads, insurance companies are responsible for all the ills in the health insurance today, and we're responsible for it. And if you just got rid of insurance companies, if they'd never been around, you wouldn't have all these problems today. At least that's the rhetoric. It's unfortunate rhetoric, because I think at the end of the day, if you talk about the problems in the health insurance field, there's a lot of blame to go around, and it goes around to all parties. We could spend all day talking about health reform. I think Congress has spent almost a year talking about it. They've got two bills. If you look at those bills, there are thousands and thousands of pages there. There are lots of nuances and pathways, and we don't have that kind of time today. So what I'm going to do is kind of hit some of the highlights. And as Professor Blumstein said, sometimes I'll be wearing my BlueCross hat when I say this. Sometimes it'll be my own personal observations. First, remember history when you're talking about this. Health insurance is not that old a concept in this country. It really started about 70, 80 years ago. And it started with the BlueCross BlueShield plans, like BlueCross BlueShield of Tennessee. And those plans were actually created by hospitals and physicians in order to ensure that hospitals and physicians got paid for the services they delivered. In fact, if you go back 50 years and you look at the board of directors of any BlueCross or BlueShield plan, and those were the only health insurance companies that existed at the time, those board of directors were all hospital CEOs or physicians. Now, times have changed a little bit, but do remember, this is not that old concept. 50, 70 years ago, it used to be total free market in healthcare. That wasn't working. Physicians, hospitals weren't getting paid. They were concerned about payment, so you came up with this concept of health insurance. You had a lot of hospitals that were locally owned, community or religious based. Small physicians, small pharmacists, and today we've morphed into a lot more for-profit. Certainly here in Nashville, Tennessee, we're aware of that. Headquarters of several major for-profit hospital systems, larger insurance companies, larger physician groups, a lot of consolidation. In our own BlueCross world, 10 years ago, we had 180 different BlueCross plans. BlueCross, the way it works, we're like Wendy's. There's an association, and we have territories. BlueCross BlueShield Tennessee has Tennessee as its territory. So there used to be 180 BlueCross plans 10 years ago. Now they're 39. So consolidation even in our industry. So do remember history as you start talking about this, because I think history is informative. What's driving the debate? What's driving the demand for change out here? Well, I think several things. There's a general perception that the system is broke. And that's even though if you survey people, most people, maybe even 75% of folks will say they're very satisfied with the health insurance coverage they have and with the health care they receive. But there's still this perception out in the public that the system is broke. And what's driving that perception? Number one, you've got an increase in the number of people who don't carry health insurance in this company. And that increase has been going on for about 10 or 15 years, about 45 million people. Now, you hear a lot of the people purporting for universal coverage talk about that, but when you start delving into the numbers, and the best person I've ever heard talk about this is Bob Corker. there's a lot of different sorts of folks in that 45 million number. Half of that number are people who just choose not to buy. They can afford it, they just don't want it. But that drives the debate of quality. The general perception that there's a lack of quality in the delivery of medical care, that we need more regulation, better practices to drive quality. Certainly spiraling cost. I mean, healthcare is expensive, and it gets more expensive. Premium, it drives faster increases than inflation. And finally, this sort of administrative regulatory hassle. There's a reason I have so many attorneys on staff at BlueCross Tennessee. We have a heavy regulatory overlay. How health care claims are paid is really Byzantine, if you ever get into that and look at the coding, and we could spend a day talking about that. But that's what's driving the debate here, a sense that the system is broken. So what are we talking about, this health care reform? Do remember, you know, there's a sense that we talk about commercial insurance. What were the two largest, really, quote, insurers in this nation today? Anybody? Well, it's Medicare, Medicaid. And I love Professor Blumstein, cooperative federalism on the Medicaid program. He hit it right on the nail about what Medicaid and Medicare are. These are really entitlement programs. They act like insurers, but they're entitlement programs. You qualify. If you qualify, you are in. You hit a certain age or certain other qualifications, you're in Medicare. If you have certain financial lack of financial ability, you can get into Medicaid or TennCare here in Tennessee. And these programs cover 35, 40, 45% of Americans today. And they drive a lot of the debate in healthcare. They drive reimbursement rates. They drive benefit decisions. So the federal government has a big play in healthcare today without even talking about healthcare reform. Keep that in mind. The debate, and I was going to cover this, but Professor Blumstein did such a great job. What we're talking about in this debate is insurance, which we have today in the commercial market, versus entitlement. And you need to remember that, because we're talking about guaranteeing everyone health insurance. That's not health insurance, that's an entitlement. That means you get it whether you want it or not. And you can have the debate, it's a good debate to have, but don't call it health insurance reform, because it's not health insurance. Insurance is when you buy insurance and you assess a risk and you pay an amount because of the risk that's involved in that. It's not an entitlement program. So do keep that in mind. I think also when we look at these bills that are pending before Congress, you're talking about the issue of control. Federal versus state control in the commercial market. The Democrats in Congress want control in Washington. Those bills move control of the health insurance industry, of health insurance into Washington, D.C. The way it works today, most of that control really resides in the state capitals with the insurance commissioners, state control. So that's one of the big overlying things you're talking about. And don't believe that cost will not increase under either of the bills that are currently before Congress. The Congressional Office of Budget has measured both of these, and the cost will increase anywhere between $800 billion, I think, on the Senate bill, to $1 trillion or more on the House bill. It's going to cost a lot of money to implement either one of these bills. And they both contain what they call cost containment, ways to pay for it. One way, I think the House bill pays for it, is the so-called reductions in the cost of Medicare, a program that is scheduled to be insolvent. And again, I'm going to quote Senator Corker here. He says, how do you pay for a program by taking money away from a program that's going to be insolvent in 5 years? How do you do that? I don't know. I like Governor Bredeson's comment on this when he talks about the changes coming in Medicaid under either one of these bills, the mother of all unfunded mandates back to the states. And I think he's right on that. Note that these are complex bills. We can talk about big concepts, but there's a lot of nuances into these bills. There were a lot of deals made to get both of these bills through their respective House and Senate. And there's a lot of complexities there. You've heard about the Nebraska compromise where Nebraska got kind of a deal that they wouldn't have to pay for any Medicaid increases forever in order to get Senator Nelson to buy off on this. And so there's a lot of complexity in these bills. Where are we today? Well, it's nice to talk about both of these bills, but I don't think the debate there is really any longer relevant. The Brown election in Massachusetts is a game changer for health care reform. The Democrats lost their filibuster-proof Senate. More importantly, I think there was a message coming out of Massachusetts on health care reform. The polls have been steadily moving against these health reform efforts, and the vote in Massachusetts, I think, was a referendum on these bills, and it was not a referendum in favor of either of these bills. Recall that Democrats, particularly the president, wanted a health care plan done and on his desk by the State of the Union address. Now, I think he speaks in about 7 hours, and I don't think he's going to have a health care bill on his desk signed or ready to be signed by the time he delivers that address. Seriously, these health reform initiatives, both the House bill and the Senate bill, are dead in the water. They're not going anywhere. There's several articles in today's paper. Democrats don't know what to do with either of these bills. They don't have a strategy to move either one forward. They both passed by the slimmest of margins in both houses. They're very different from each other. And to drive any sort of compromise on these bills, I think is not going to happen at this time. Truly, the Brown election in Massachusetts was a game changer. I think, and again, I've quoted Bob Corker a couple of times. I used to work with Bob and have a great deal of respect for Senator Corker. I think if you listen to what he says on health reform, he studied the issue and he's got it down. Where do we go from here? I think either one or two things are going to happen in Washington. Either you'll have no health care reform bill, and this thing's just going to die. We're going to have to deal with these issues going forward. Or you'll have what happened when the Clinton bill failed. They're going to scale it back, and there will be things done that perhaps might be beneficial. Remember, when the Clinton bill failed, they still passed the HIPAA laws. They passed S-CHIP to help kids. So you may see some of more dialogue involving both parties coming together on other issues. The problems are not going to go away. They're certainly significant, but I don't think either one of the bills that we've got in front of us today are going to be the catalyst for change. So with that, Professor Blumstein, I know I went past that 1 minute. You gave me about a minute and a half ago, but I'm going to hand it over to my good friend Gerald Summers.
Thank you.